Hello friends, I am Dr. Parimala Devi, Senior Consultant in Fortis Hospital Bannerghatta Road. I am a consultant in Obstetrics Gynecology and Prevention of Cancers. Since nearly about 35 years, I am in this field and there in Fortis Hospital Bannerghatta Road since 14 years. Today my concern is to speak about polycystic ovaries. Why I am choosing this subject is polycystic ovaries is such a common problem. Many of the young girls, maybe as early as 13 to 14 years to 30-35 years, they present to us in the OPD when we are seeing patient in big number. We can say it's nearly about 10 to 20-25% of the incidence is there. Why this polycystic ovary is so common? What is this? We have to understand today. Usually these girls are young women present to us with these symptoms like irregular bleeding, or they may come, especially the very young girls, they will be so shy to come and tell, and they come with their mother or from their college friends to tell that they are recently developing lot of hairs on the face, on the cheek, and also on the upper lip, and also on the abdomen. So, and also they may come, we are these days without eating much also we are putting on so much of weight. These will be the concerns. And also sometimes they will be so smart to say like they will be already have finished the sonology report, and because they will have some pain abdomen or irregular menstruation, and they will come with a scanning report and tell us that, madam, we are having PCOS. They will come with a diagnosis only. So first let us understand, let me address our young girls and women that PCOS is not a big disease or anything. It's a lifestyle related disorder, we can say. So you all need not be so much worried, because in polycystic ovary, what we call as PCOS, because that is polycystic ovary syndrome or polycystic ovary disease, all the same they are. Simply people will think that is different, this is different, and they worry themselves. Here there will be irregular bleeding, hairs appearing on the face and also on the abdomen, and also there will be increased unnecessarily lot of weight they will be putting on, and they will be suffering from lot of stress and inferiority complex. So here why it happens is, it's because one is there is a hormonal imbalance because of the increased weight, and also there can be what is called as hyperinsulinemia, that is there will be increased secretion of insulin from the pancreas, which is related to again the increased weight of the body. And you know that as girls, as women, we have two important hormones called estrogen and progesterone. This we all have to know, because we have ovary, uterus, and tubes, and fallopian tubes, and the cervical reproductive organs. These ovaries which produce these hormones are mainly controlled by, like how we are all controlled by our parents and our teachers, they are controlled by what is in the brain called hypothalamus or pituitary. When there is an increased stimulus of this ovary because of this insulin resistance, because of the obesity, or because of the lack of exercise, there can be increased secretion of the androgen, and also there can be the lack of ovulation. Every month a woman is supposed to liberate one egg. That egg will give the menstruation, that will be giving us lot of good hormones to maintain our weight. But what happens here is there is no ovulation, so there is irregular bleeding, and there will be, because of irregular bleeding, and there will be increased androgen sensitivity, insulin resistance, and the hairs will start appearing on the face. Like this, PCOS or the polycystic ovary is a lifestyle disease. Don't worry, with your regular exercise and a good diet where you can avoid some junk food and also processed food, and irregular food habits can be avoided by having a good lifestyle and by avoiding unnecessarily sitting and sedentary lifestyle. Whenever possible, people should be active, and you should be able to do some exercise at least 5 days in a week, and to make your life simple by bringing down your stress. Everyone is having stress. Who don't have stress? Just to tell on the fun side, even a baby which is born also is stressed these days, because it will be waiting whether it will get milk or not. So stress is a part of our life. When we want to do something, bring down your stress, follow a very good lifestyle, and follow a good diet. Try to depend on the home food, and try to follow all the good habits and try to stay healthy, happy without PCO, because PCO, if it is untreated, I want to tell the last two words, it can invade diabetes and it can make you infertile, that is not conceiving to some extent. So please see that you improve your lifestyle and avoid PCO, that is polycystic ovaries. Actually, it is not necessarily, it is the same, something like a tailor-made symptoms or anything in PCO. What may happen, like sometimes, as I said, they may come with the scan report in the hand, yes, the ultrasonography report, where there can be some ovaries are a little bit ballooned and there are multiple follicles in the ovary. That of course you can call as ovaries are showing polycystic ovary. But it doesn't mean that the girl or woman is already having the polycystic ovary disease. Because to say that, some women may have like the loss of hair and hirsutism, that is the very main symptom because of androgen production. They can have hairs on the upper lip and also on the chin and on the side locks. And also some people may show a lot of weight putting on, but they may not have all these hirsutism and all. So it is sometimes not typical, and there are very few girls who will come only with irregular bleeding, 1.5 months, 2 months they will bleed. If they bleed also, their flow will not be normal. It will be very less brown color bleeding. So like this, they may present with 1 or 2 symptoms, but to call it as polycystic ovary, we have to have a scan finding confirmed, where we say typically a necklace of pearls is seen, that multiple follicles are seen, and also the hirsutism on the face, and also little bit of extra weight, the obesity. All these things will be called as the term that polycystic ovarian disease or polycystic ovarian syndrome.